things, but I think for kids that have trauma, their brains are already not functioning normally.
What about the healthy? So I think like
Great
one thing
point.
that's it's it's less of a it's a more difficult topic in a way because it's not as cut and dried like anybody, it's not bipartisan in a way
Yeah,
or whatever you want to call it.
right.
But I guess one hesitance I always had about psychedelics when I first saw that, I was probably first exposed to people doing them in college, and I actually was pretty put off because they were doing them in these party settings,
Yeah, yeah,
and and looking back on it, I honestly still feel that way, having done them myself, and have a very positive opinion. But I just think, if you're going to be, like you're saying, it's like adding memories to your childhood, or, this is a very serious thing. The question is, what's kind of, do you have tips and tricks, or like where would you like to see the culture, like in the ideal world, the culture of kind of the healthy, quote
yeah,
unquote,
yeah,
I mean, whatever that means, right?
yeah,
Using psychedelics in their lives, like what's a constructive way to do that? What are the
yeah.
kind of rules of thumb that like would help
Well,
people get more out of
okay.
it?
So also, in a sense, you're talking about either medicine, where you work with people that have disorders, or preventative medicine.
Yeah, or optimization as
Yeah,
like, yeah.
yeah, yeah. So I think that in order for us to get to the point where it's legally available for people, for optimization, for preventative medicine, for personal growth, for couples therapy, just for spiritual experiences, that's going to be outside of the medical frame.
Mm-hmm.
So we need drug policy reform to do that. But I think that's going to be one of the best uses for it, was rites of passage as people are growing up to kind of process things early. But the other part of it is these religious psychedelic churches, which
Mm.
are growing incredibly. My favorite is, and I'll explain why it's my favorite. But it's called the Church of Ambrosia, and started by a friend of mine, David Hodges. And the Church of Ambrosia is in the Oakland, in the Bay Area. It has 125,000 members, and they provide around 90 pounds of mushrooms every month to the members. Now, I think what's keeping them sort of safe is it's not a mail order business. You have to go to the church and pick them up, but then you get this instructions for how to have a spiritual experience on your own um, at home. In Oregon, the Oregon Psilocybin Initiative was sort of the first statewide reform, and they are explicitly for two kinds of people: one that have diagnosis, one that wants to just personal growth.
Mm.
And they work with guides who have licenses to do therapy or not. So you can be an underground therapist and you can go through their training program, and then you can be now legally authorized to give psilocybin to people.
Mm.
Similar situation is being created in Colorado,
Mm-hmm.
which is also going to be for multiple different psychedelics. New Mexico just passed a bill, but it'll be more limited to medical diagnosis. So I think that, as we started earlier by talking about Island by Aldous Huxley and this idyllic society with psychedelics, and they had rites of passage for kids. They had psychedelics throughout the lifespan. So I do think that if we move from treating illness to preventative medicine kind of thinking, we're going to move more and more towards psychedelics for personal growth, for the healthy,
Mm-hmm.
for optimization. And I think that's completely appropriate, and that's where we need to go. And so the psychedelic religions are one way where, right
You mean
now,
that from like a legal perspective, or from, but what about from like the practical? Let's say I'm, at this point, they're almost legal on a personal level. Like there are not a lot of people getting in trouble for using psychedelics, right? So that's more of like a game that's being played somewhere in the upper echelons of, pharma, politics, whatever.
yeah,
But like on the personal level, it's that's probably less important now than it was 20 years ago,
yeah,
right?
yeah, yeah, I think so. I think that because of the crisis of fentanyl
Yeah.
and the overdoses with opiates and fentanyl, the DEA would get a lot of criticism if they were going after underground psychedelic therapists, and people are dying at enormous rates from overdoses to fentanyl
Mm-hmm.
and opiates. So there's been generally a change in public attitudes towards psychedelics. People don't automatically think underground psychedelic therapists are terrible. And now, the rise of the religious right, you can do so much in the name of religion. You can discriminate in the name of religion. You can do all sorts of things so that there's not hardly any enforcement against psychedelic churches. So I think that this attitude. If we look at what kids are being educated in schools about psychedelics, it's still pretty much drug war propaganda
Mhm.
about anti-psychedelics. Marijuana causes lung cancer, which it does not. But people are still being taught that marijuana causes lung cancer. So I think what we need to do eventually is move towards honest drug education.
Mm.
We need to move towards harm reduction techniques. So MAP started the Zendo project, which is psychedelic harm reduction at Burning Man and other festivals where people take psychedelics for fun, but a lot of them catalyze deeper experiences that they're often not prepared for. Um, when Sasha Shulgin and Ann Shulgin, he's sort of the godfather of MDMA, reinvented it in the 60s and early 70s and helped move it into therapy, um, primarily like around 76 and on, he put out a pamphlet. Ann and Sasha had this pamphlet of a couple pages of education about MDMA that went along with the MDMA itself. But it ended is there's no such thing as a casual experiment, meaning that even if you take it for fun, you need to respect it. You need to be
Mhm.
open for whatever comes up. And when you're not, it makes it more likely to be a difficult experience. So, for example, this was now probably about 20 years ago, um, and well, maybe 15 years ago. Okay, so we had two women contact us in the same week, and both had the same story. They had taken MDMA at a party setting, and memories of sexual abuse had come up. And they, one of them said that she was with a bunch of friends for a party. They didn't want to talk about it because she knew it would be more serious. She stuffed her feelings down, and months later, she's feeling worse off. And so MDMA was harmful to her in this way because it brought stuff to the surface that she wasn't prepared to deal with. Um,
Yeah.
then the same woman, a different woman said same story, but she was with a girlfriend. They went off into the corner. They talked about the trauma. She worked through it a lot. She went back to the party. She had a great time. Now she thinks MDMA should be great for PTSD. And she thought she came up with the idea. So she did a Google search and found out, oh my God, MAPS is researching this. So she contacted us. So I think we need honest drug education, harm reduction at events. We need treatment on demand, ideally paid for by taxes from selling the drug. And we need pure drugs.
Mhm.
And you get that all through this legalization. So I think the drug war is so counterproductive that if we were to end it right this second, it would be better off than we are now. But we should be layering in these other things. So we create a culture and a context that's supportive of experiences for optimization, personal growth in relatively, quote, healthy periods.